Healthcare is too expensive. Employers are offsetting costs onto their employees. Who will make health benefits affordable for hardworking Americans and their families? You will. This is the Empowering Plans Podcast, a show dedicated to helping you once again emphasize the benefit in benefit plan. Now prepare to learn, plan, save, and protect with the FIA Group.
Welcome to another exciting episode of our Empowering Plans podcast. Today, I am your host, Jen McCormick, and I am thrilled to be announcing that I have Joanie Verinder joining us for her first ever podcast. This is an exciting opportunity for us to chat together today and have a conversation about some of the recent trending regulatory updates and what the potential impact is going to be. Joanie, you want to go ahead and say hi? Everyone is eager and anxious to have you join us on a podcast today.
I'm excited. This is my virgin podcast, so woohoo! I'm very excited about that. And this will probably just be like one of our calls that we have together that we talk about this stuff because I don't have a life. So
This is life. This is life. Regulations and compliance. This is the good stuff. So this has been something that we have been hoping for, the official end of COVID. I know that there are a lot of trending issues and a lot of things, in fact, that we had even planned on chatting about today. But as of last night, the rules have changed. Plans need to be aware of this. There are some important implications, plan changes, actual system changes, modifications that plan sponsors, administrators, everyone in the industry really needs to be aware of so they can take care to do their due diligence and make some updates. And what am I talking about? COVID, the end of COVID. So
I thought we were through with COVID.
I know, everyone said that the end of COVID was going to be on May 11th, but it seems like that is not actually the case.
Wow, nothing like the government to change their mind, but it's good to know that the COVID emergency ended, and it is, it's just a lot to unpack now for our plans. Specifically, on Monday, April the 10th of 2023, and this is a month before it was initially planned, Congress passed and President Biden signed HG Resolution 7, which ended the national emergency.
I know, as we were also doing some timelines and math problems, and I can't decide if this is something where you are required to have some sort of degree where you can count the number of days, or there's some sort of system or app that we can use to help us to calculate when and what goes into effect. Because now we're going to be balancing multiple different deadlines for the different emergencies on top of what ends today, what ends on May 11th, what ends on August 9th. It's a wild, wild ride for all of us to try to unpack this. So maybe I'll give a little history to make sure everyone's caught up on what exactly we're talking about. I do think that the distinctions between the national emergency and the public health emergency can be confusing. So maybe we can give a quick background on that and kind of go from there. So we have been working through COVID for a long time. So in fact, dating back to January of 2020, hard to believe, was when the first public health emergency for COVID had been declared, going into effect in February. Most recently, it was renewed again. And this is a period for the public health emergency that is continued to be renewed every 90 or so days. And at the time that the most recent effective renewal went into place this year in February, that is where we were notified that there was the intent to end on May 11th of 2023. And we were under the impression that the public health emergency and the national emergency, although they mean different things and we'll explain shortly, would be set to end at the end of the day on May 11th. So the national emergency, that was the one that came along later from the president and had been declared in March of 2020. And the difference between the two is important, not only for what the implications are, but to understand the timing of them. So, Joanie, do you want to give us a quick background on the public health emergency, what it means and why it's relevant for plans?
Sure. The public health emergency is the one that came out that mandated the COVID testing. And it was amended as new tests came out to include those. It included the over-the-counter testing and mandated that plans pay for them, whether they're in or out of network, without cost sharing, without prior auth, or any other kind of, big medical management requirements. So those really put a new requirement on plans for coverage of items, especially the OTC items that weren't previously necessarily covered at 100%.
So during the public health emergency, that means that plans, grandfathered, non-grandfathered, are required to cover certain diagnostic tests as a result of COVID-19 without any sort of cost sharing or other requirements on those plans while that is in effect. Is that what you're saying?
Exactly.
The national emergency, this one gets a little bit confusing and people didn't necessarily understand why this was a different provision of the plan, but the national emergency is more so tied to timing and time periods that had been in place for a particular plan. So for example, there are certain things that we need to do when we're working with benefits and certain timeframes that we need to be aware of, and that would be special enrollment under ERISA, that would be COBRA continuation, paying our premiums for our COBRA benefits. Also, when we're filing an appeal, when we're filing a claim, when we're filing an appeal, when we're requesting an IRO external review. There are a lot of different timing periods that we need to be aware of when it comes to our benefits. And the national emergency is the emergency that allowed plans to toll, or they were required then to disregard a certain period of time for which the time periods would count. And we won't get into the specific math, but generally what the rule was for the national emergency, that a plan was required to disregard the period of time from March 1st, 2020, which was the date that national emergency had been declared, until either 60 days after the end of the national emergency or any other date that's no longer than a year. You could have no more than a year. That was your maximum time period for tolling. So the end of the national emergency is really why we decided to have this chat today, because we'll get into the specifics, but the national emergency has ended. So that means that all of the tolling relief that had been put into place as a result of the national emergency has come to a close. So we now have 60 days or a year after the end of the national emergency, and I'll let Joanie do the math for us for what that means. But it means that we have one less month to make these changes, to make these modifications, and we'll go into the weeds a little bit about those. But what's the date? What do we need to do, Joanie, for the national emergency?
Well, the magic number that they had given us for the outbreak period was July 10th, but that was when it was anticipated to end on May 11th.
So what does the end of the national emergency actually mean as far as these timing extensions? Well, the tolling relief granted under the extensions of certain timeframes for employee benefit plans, participants, and beneficiaries affected by the COVID-19 outbreak will begin to wind down. That is a mouthful, huh? And that does include the extensions that we had chatted about for special enrollment, for our COBRA elections, for COBRA premium payments, for notifications of disability, for claim filing and appeal deadlines, for IRO requests, and submission of additional information to perfect an external review. So this means that any deadline tolling, which was not already ended due to hitting that 1 year maximum, is now going to end at the expiration of the outbreak period. And that is going to occur 60 days after the national emergency. However, with the national emergency having ended on April 10, 2023, we originally were under the impression that that potentially meant the outbreak period would end on June 9th, 2023. However, that is not the case, and it appears that the outbreak period will still end on July 10th because of that House resolution that Joanie had mentioned earlier, and it does not have an impact on the outbreak period. Instead, it is that time frame extension rule and in effect outbreak period that relate to the national emergency that had been declared under the Stafford Act, and that is not being impacted by the resolution number 7. So all that saying that the Stafford Act declaration is still expected to end May 11th, meaning that the outbreak period is going to end on July 10th. So all in all, even though the national emergency ended and terminated 30 days earlier, the outbreak period will not change. So hopefully everyone is clear the difference between the public health emergency and the national emergency. The public health emergency is still in effect, national emergency is not. But we had the privilege just a few weeks ago to listen to the Assistant Director of EBSA come and meet with us and share some of her priorities when she's working with the EBSA of what is important for the agency and where they're focusing. And one of the takeaways from me was that communication, notification to plan sponsors, plan participants of the benefits was really crucially important. That individuals needed to really understand the benefits that they had available to them, how to access them, and that they existed. It was key from this conversation that participant notification was important. And in addition to that, of the priorities that she had identified that the agency was going to be working through, the end of the emergencies was something that she had pointed out. And she had noted that it was her opinion that participants may not necessarily know what the public health emergency meant, what the national emergency had meant as it related to their particular plan benefits. And it was on the plan sponsor, there was a plan sponsor responsibility, obligation, duty to work through this transition and make sure that they were providing updates and messaging to the participants if and whether their benefits could change, how they would change, and what they might mean as a result of the change. So I think it was interesting. And shortly after that conversation, we received some FAQs from the DOL where they helped us to prepare the plans for the end of COVID and what it would mean. And again, I think it's very interesting that in these regulations that were released on March 29th, there is the reiteration that the public health emergency and the national emergency were anticipated to end on May 11th, 2023. But yeah, you want to talk through some of the FAQs of what happened about a week and a half ago and what the agencies were telling plan sponsors to do and some of the implications, maybe some of the highlights?
Sure, and would recommend that people go out there and check these out. I mean, I know that ever since the start of ACA, we've sort of gotten used to receiving sub-regulatory guidance through the FAQ process. And these are out there where the DOL normally puts the ACA FAQs. This one is part 58. Jen, can you believe we're on 58 and just what, 13 short years since the start of the ACA? We're at part 58.
We made it.
I know, woohoo! Is there like a cake or something when we get to 60? I don't know. There should be some celebration when we get to 60 FAQs.
I know, I mean, May 11th, that's the party date, right?
There we go. But in those FAQs, they kind of walk you through and starts off with, do the COVID-19 testing coverage requirements under Section 6001 of the FFCRA apply to items and services furnished after the end of the PHE. And they come out and actually say no from the very beginning, that you don't have to continue covering these at the zero cost share like you did before. They do put in bold, however, plans and insurers are encouraged to continue providing this coverage without imposing cost share or medical management requirements after the PHE ends. So that will be one of the considerations a plan needs to make on whether or not they want to continue that. But as always, we would also suggest that if you want to be more generous, which you can, just make sure you double check with your stop-loss carrier on those things, because sometimes they just want to cover, if it's required, then we'll do it. If it's not, we may want to look at it, or they may even want to, reevaluate your coverage after that. Now, they also talk about in one of the FAQs about the vaccine that was under that. One of the parts of the CARES Act was, instead of most things that are approved under the USPSTF for preventative services, once it's approved or gets its A or B rankings, you have 1 year, and then the first date of the plan year following 1 year after the approval comes on is how you normally have to cover it. And they kind of waive that for the COVID vaccine. Well, you still will have to provide that under the preventive, but that's only for in-network. So if you have different benefits for out-of-network, or you don't cover the preventive services for out-of-network, that's where the vaccines will now reside.
It was pretty interesting. So And going through those FAQs, thanks for highlighting those. I think that it's important for everyone to remember the guidance too from the EBSA that notification is going to be important, and making sure that you're going through this. And you had noted that it's encouraged to continue this coverage, but having the language in the plan, you'll have to review it to make sure that the language had been written in a way that would allow the plan to cover the coverage on a continual basis. Everything is going to be very nuanced, and you have to make sure that the language that you had implemented, in fact, reflects the intentions of the plan when it comes to the public health emergency. And the other thing before we hop to the national emergency that I thought was pretty interesting too is that there were some, I love to talk about mental health parity, but there were certain opportunities for plans to disregard how they were providing their COVID-19 benefits when it comes to the calculation of QTLs for how benefits were being calculated to ensure that they were in parity. So that relief is going to no longer apply for a mental health parity basis. So when you are making these changes, if you do decide to continue to offer the coverage for the benefits, not only do you need to make sure that the language is in line with the plan's intentions, but that you're not inadvertently creating any mental health parity rules by continuing to waive these benefits in a way that would not necessarily be in parity. So keep that in mind when you're making. But for the national emergency purposes, yes, this was exciting. This was news. President Biden did sign this bill, as you had noted, and this is ending earlier than we thought it was going to be.
And even though the national emergency is terminated, as we're summing this up, as of April 10th of 2023, as we earlier talked about, the outbreak period is based on the national emergency that was declared under the Stafford Act, and that act is still expected to end on May 11th. So the feeling in the industry is that the outbreak period is still going to continue on to July 10th. So the examples when the FAQs are correct and no recalculations will be necessary. Jen, you'll be excited about that because there'll be no math. So even with the declared end of the national emergency, the outbreak period is still anticipated to end on July the 10th.
And the other thing that I thought was interesting, also in bold here in the FAQs, is it says that there's nothing in the code, there's nothing in ERISA that would prevent the plan from allowing for longer timeframes for employees, participants, or beneficiaries to complete these actions, and that plans are encouraged to do so. Talk about confusing. We were having a hard time making these calculations here as we're going through this. So the plan has language in their documents or an amendment that outlines what the public health emergency changed as far as their benefits, what the national emergency changed as far as their benefits. Now we're aware that the national emergency has ended, but the FAQs that had been previously released are encouraging plans to continue offering the coverage that's tied to the public health emergency. They're encouraging the continued longer timeframes for the national emergency timeframes and time periods. What are we supposed to do with all of this information, Joanie? You want to wrap us up here and give us some good summary action items?
One, if you are going to consider probably extending any of these deadlines or extending any of these coverage, again, talk with your stop-loss carrier to make sure that they're on the same page with you and will allow it. I know it's been a hard pill to swallow for several when claims have been filed and they've been filed what is normally, like if you had a 12-month timely filing limit normally, now that kind of got extended out to 24 months. So, that kind of, it crossed stop loss periods. It caused confusion with people on whether they should pay it or not. So one, I would double check with your stop loss carrier. Two, I would pay close attention to any of those amendments that you sent out, because some of them, I know Jen had a sunset date or had an expiration that they ended with the end of the public health emergency, or possibly ended with the end of the outbreak period. So if you were going to revert back to the way the plan was prior to all of this, and you want to make some of these exceptions, or you want to continue providing the COVID testing for no cost share, you might need to amend your plan to be able to do that if the language prior to those amendments for the COVID testing and for the PHE and the NE, the public health emergency and national emergency, if that prior language didn't support it, you may need to amend your plans to do that if you didn't have that kind of termination date in them. And if they're open-ended and don't have a termination date, you may want to look to amend it to take it out if that's what you want to do now. Yeah, I think another thing to look at with these is just make sure that everybody is aware and on the same page when it comes to these things expiring, because not only does it affect your plans, this also affects Medicaid, because now Medicaid previously couldn't decline to enroll or verify people's eligibility to remain on Medicaid. It would kind of had frozen it. And now that the national emergency is over, then the freezing on this Medicaid eligibility, I guess, is de-thawed. And so now these people might be kicked off Medicaid rolls, and so therefore would have a special enrollment right under your group health plan. So you may want to be aware that these people could be applying, and it would be a special enrollment under your plan.
Wow. And that tied on top of the most recent alert that we just received about the HIPAA notification for the discretion and how they'd be enforcing what types of penalties could or could not apply for providing mental health during the COVID timeframes, and essentially allowing for some leniency, keeping in mind all of the protocols and things that we're trying to deal with as we're transitioning to a post-COVID world. So that is expiring, and that gives us a transition period, which is different than the 60 days and different than the public health emergency date of May 11th. So lots for us to keep track of, lots for us to sort through, but it's important that everyone is aware of this and does the best that they can to communicate as proactively as possible with plan sponsors, with everyone that would be involved here, so they can do their due diligence and make sure that everyone is aware of all these important happenings and how they relate to plan benefits. So
it gives you myself to practice your math.
I do need to practice my math, or I can just rely on you. Hopefully for that. But no, thank you so much, Joanie, for joining us today. I think this was hopefully very informative for everyone, and they are walking away with a little bit more information and hopefully feeling prepared about what their action item list should look like as we prepare for the official end of COVID. So thank you so much, everyone, and enjoy the rest of your day.